Can it possibly be true that women giving birth in our country are more at risk than women in dozens of other nations around the world? Afraid so. Erin Moriarty has the stories behind some terrible statistics.
So, Mommy, where you at?
Beautiful Palm Springs.
Fearless is how Charles Johnson describes his wife, Kira.
I love you.
We're talking about a woman that was a marathon runner, that raced cars, that was a skydiver.
It never occurred to him that the greatest danger Kira would face would be going to one of the best hospitals in California to have a baby, their second son, Langston.
Hey, Mommy.
Hi, Daddy.
Hey, Langston. For us, we were really and truly expecting this experience the second time around to be a walk in the park.
It was a C-section, not because there was a problem, right?
They suggested that you had one before, and they recommended that she have another cesarean. Hey, Langston. I'm waiting on you, buddy.
The first sign of a problem came in the late afternoon of April 12, 2016, shortly after Kira gave birth.
I was sitting by Kira's bedside, and I began to notice the catheter turn pink with blood.
A doctor ordered a CT scan, a CAT scan. Johnson says he didn't worry at first.
Something's not quite right, and I was aware of that, but we've got a plan. And she's in what I thought were great hands.
And how's Kira feeling during this?
Lethargic. I'm continuing to advocate and ask more adamantly, look, when are we taking her for the CT scan? 7 o'clock rolls around, 8 o'clock goes by, 9 o'clock comes, 10 o'clock comes.
There's still no CT.
Still no CT scan.
Shortly after midnight, his wife was taken into surgery.
She's holding my hand and she's saying that she was scared. And I'm telling her that everything's gonna be okay. Everything's gonna be okay. And that was the last time I saw my wife alive. When they took Kira back to surgery, there were 3.5 liters of blood in her abdomen. And she coded immediately.
And when you say coded, she died.
Her heart stopped immediately.
Kira Johnson was 39 years old, and her death isn't just a personal tragedy. She's part of a disturbing national trend.
The United States is the only industrialized country where the rates of maternal deaths have increased, not decreased. And so young women actually have a higher risk of dying during pregnancy and childbirth than their mothers did.
Dr. Marianne Etiobet is executive director of Merck for Mothers, a program run by the pharmaceutical giant Merck to reduce the number of maternal deaths throughout the world. She never guessed that one of the countries most in need was the U.S.
60% of the deaths in the United States are preventable.
And where do we compare to other developed countries like Great Britain, Canada?
The United States is ranked 46th when it comes to maternal mortality. That's behind countries like Saudi Arabia and Kazakhstan.
In the U.S., that means at least 2 women are dying every day. And it's not just deaths on the rise. So are near deaths, 60,000 a year across the country.
When it was happening, it would go on from anywhere from like 15 minutes to an hour. It felt like my body just wanted to crumble.
Amber McLaughlin was 29 years old and 8 months pregnant when she began to feel an excruciating pain that would come and go. She says her doctor wasn't alarmed. They're telling you, no, don't come in, we've seen you, you're fine?
They told me to go home and rest. They said, you're 35 weeks, you're probably uncomfortable, go home and rest. And I said, not going home, I'm coming in today.
Even then, a nurse practitioner hesitated and then relented, sending McLaughlin for tests.
I get hooked up to the monitors, and a few minutes, I mean, it felt like 2, they came rushing in. And they said, where's your husband? This baby has to be out in 10 minutes.
She had developed a rare condition that caused her blood pressure to skyrocket, putting both her life and her baby's at risk.
I'm thinking to myself, I was right this whole time. Why has it come to this? And so at that moment, I Even at 5 years later, it's one of those things that when nobody believes you.
When McLaughlin's son was delivered by emergency C-section, he weighed just 3 pounds.
Was there a time when you really wondered whether you'd ever get to see your son?
That first day, he was really struggling. I mean, they told us that he was at pretty close to the end.
Was your life ever at risk?
Part of when I was saying, quote unquote, I think I'm dying, that's because I truly believe that my kidneys and my liver were starting to shut down.
So what's causing this spike in maternal deaths? There are a number of factors. More women wait until they're older to have babies, and often they begin their pregnancies less healthy, with chronic conditions like obesity, high blood pressure, and diabetes. But some medical professionals say the real problem is how those babies are delivered. They blame much of the increase in deaths and near deaths on a dramatic rise in C-sections.
If you have a C-section in 2018, you have a 90% chance of having a C-section the second time. But the second time, it's a more complicated surgery, and the third time, it can be like operating on a melted box of crayons. And in those cases, women can bleed to death.
Dr. Neil Shah is a professor of obstetrics at Harvard Medical School.
The pain is okay.
And a practicing physician.
Are you also saying that some of these C-sections are just not necessary?
Probably more than half of them.
And when complications do arise, says Dr. Shah, doctors don't always listen to their pregnant patients.
I think there is a dimension of gender discrimination. If a woman after a birth goes into a hospital with concerning signs of a complication, there are no rules for how quickly an obstetrician has to see her. And in fact, it's a routine case that it'll take hours.
And statistics indicate that it may not just be gender that plays a part in dangerous delays, but also race.
If you're a woman of color in this country, especially if you're black, your odds of dying in childbirth are 3 to 4 times higher on average in our country.
Why? Because you're not talking about access to health care. You're not talking about money or education.
No, and this is going to be hard to hear. We believe black women less when they express concerns about the symptoms they're having, particularly around pain. And that's the common thread in all the stories we've been hearing in the media, including Serena Williams.
Yes, even Serena Williams, the world-class athlete who developed a pulmonary embolism after giving birth to her daughter last September.
We had a lot of complications, but look who we got.
She says that had she not insisted on receiving a CAT scan, she could have died.
We're leaving the hospital after 7 days, 6 days. It's been a long time.
If women with resources are at risk, imagine what happens to women without access to proper health care.
I am this baby's big sister, and this is my mom.
My first proper prenatal visit was at 16 weeks. It was terrifying. I had been bleeding for about 11 weeks before I was able to get a understanding to why.
Mom, you can't play on it.
32-year-old Akila Collier works as a full-time substitute teacher in Orlando, Florida. But she couldn't afford health insurance when she became pregnant with her second child.
I went to the emergency room, and that's where I got my prenatal care for the first 3 months. I racked up over $20,000 in medical bills during those 4 visits, and they misdiagnosed me every single time. They were saying that it looked like I was having a miscarriage.
And there's 30-year-old Ashley Lacayo, who also lives in Florida.
I have insurance, but I've never been told no so many times by people who are like, have no emotion. Oh, I'm sorry. No.
Lacayo says she initially was able to get prenatal care by agreeing to pay her entire deductible, $2,600, by her 28th week of pregnancy. But when that date rolled around and she couldn't afford the full amount, her doctor refused to continue to see her.
I called 15 or so different clinics in the area. Everyone denied me. It was just a never-ending, how far along are you? Oh, no, sorry, we don't accept patients past 25 weeks.
There you are. Oh, I got a cake here too. Women are literally shut out, left wandering the streets, trying to find someone who will help them and running to the emergency room in lieu of prenatal care.
Midwife Jenny Joseph, who moved from London to Florida nearly 30 years ago, says she is deeply concerned by the number of women who are shut out of proper prenatal care.
We are standing by, literally, as mothers and babies are suffering. And I feel like my little piece is to be able to make a difference in that.
In 2006, Joseph opened a practice specifically for them, called the Easy Access Clinic.
So you are the big sister.
It's run by nurses and midwives who include doctors when necessary. They turn no one away.
There isn't anything you can come up with that will have us say no. You can be indigent, you may be homeless. We're still going to see you. And the simple reason is because you're carrying a baby. Like, what else would we do? There isn't any, I think, ethical way to say no, go away. How's baby moving? A lot? All the time. That's what
2 months after being refused treatment by her first doctor, Ashley Lacayo heard about the clinic. Joseph saw her the next day.
Wow. This place saved me. It did. I mean, I'm doing a week, and where would I be without her?
Both Lacayo and Collier gave birth to healthy babies in May. But this problem is not going away. Since 2000, hundreds of hospital maternity wards have closed across America. Low-cost clinics like Joseph's could help fill the need, but she warns that may not be enough.
Women are sent out of a hospital 2 days after they've delivered and basically told to wait for a 6-week postpartum check, which is useless to them, given that most of the postpartum concerns, the morbidity and the mortality, occurs within the first couple of weeks after the baby's born.
But when deaths do occur, Dr. Etiabet from Merck for Mothers says each one must be counted and investigated.
Is that being done right now?
It's not being done in every state. So they're not paying attention to the issue. They're not only not going to know that there is an issue, they're not going to know how to solve it.
Slide.
More than 2 years after his wife Kira died, Charles Johnson is now a single dad, raising their 2 sons in Atlanta.
Woo! Let's go, let's go. We're winning.
Determined to keep her memory alive, he's suing the hospital and speaking out, hoping to put a face, a deeply missed face, on an American crisis.
It's immeasurable how much I miss Kira. And particularly as I see these amazing gifts that she's left us with. And there's so many things about our journey together that are bittersweet, but they're so painful because she's not here to share them with us.
Do you think Kira's death probably means other mothers will get better care?
I hope so. When you go into the hospital, ask them, do they know about Kira Johnson's story? Ask them, do they know about what happened to her? And then ask them directly, what are you doing to make sure that the same thing doesn't happen to me?